Hello friends, welcome to BMH Learning. This video is about anticardiolipin antibodies. Anticardiolipin antibodies are autoantibodies produced by the immune system that mistakenly target the body's own cardiolipins. Cardiolipins are the substances found in the cell membranes and platelets. Cardiolipins and other related phospholipids are lipid molecules that play an important role in the blood clotting process. So, these autoantibodies can affect the body's ability to regulate blood clotting. Hence, the antibodies may be associated with an increased risk of developing recurrent inappropriate blood clots in veins and arteries. These autoantibodies are better defined as antiphospholipid antibodies. The detection of these antibodies has led to the definition of a new disease entity, the antiphospholipid syndrome. Antiphospholipid syndrome is thought to be manifested by a wide range of symptoms like inappropriate blood clot formation, recurrent miscarriages, cardiolipin antibodies, premature labor and pre-eclampsia. Now, APS can be primary or secondary. Primary APS is not necessarily associated with a related autoimmune disorder, while secondary APS is associated with an autoimmune disorder. Antiphospholipid antibodies are also found in a number of infectious diseases and also in some patients with cancer. Moreover, anticardiolipin antibodies are reported to be the anti-M1 mitochondrial antibodies. They are responsible for the false positive VDRL test occasionally seen in lupus patients. These antibodies can be in any combination of IgG, IgM, and IgA classes. But IgG antibodies are the most prevalent class of autoantibody and the class with the greatest clinical correlation. How the test is useful. Tests for cardiolipin antibodies are frequently used to determine the cause of an unexplained blood clot, recurrent miscarriages, a prolonged result on the coagulation PTT. In this setting, the test is often ordered along with lupus anticoagulant testing. When the test is ordered, cardiolipin antibody testing is typically ordered as part of excessive clotting workup, that is, when an individual has symptoms suggestive of a blood clot. Signs and symptoms vary depending on the location of the clot. If the clot is in the deep veins of legs, that is, deep vein thrombosis. In this case, a person may have symptoms such as leg pain or tenderness, usually in one leg, edema, discoloration of the leg, and if the clot is affecting the lungs, that is, pulmonary embolism, in that condition, a person may have symptoms such as sudden shortness of breath, labored breathing, coughing, hemoptysis, that is blood present in sputum, lung-related chest pain, rapid heart rate. The test may also be ordered when a woman has recurrent miscarriages, and this is ordered along with lupus anticoagulant testing as a follow-up to a prolonged PTT test. And in this case, when cardiolipin antibody is detected, then the test may be repeated several weeks later to determine whether the antibody is temporary or persistent. The test for cardiolipin antibodies may also be ordered when an individual shows signs and symptoms of an autoimmune disorder and has a positive result on an ANA test. What does the test result mean? A negative result means that cardiolipin antibodies are not present or not present at a detectable level in the blood at the time of test. Moderate to high levels of cardiolipin antibodies indicate the increased risk of excessive clotting or recurrent miscarriages. This was all. Thanks for watching.